Doctors of Reddit, what's the biggest case of faking it you've ever seen? Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated "Ossa hello" wave. She started to throw her arm up but caught herself halfway through, then threw her hand back into her lap and pretended to be Ossa off into nothing. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the Tonopin, a device you poke them directly into the eye with, and they go, "What the duck is that thing?" When I was a kid I learned I could fake sick and get out of school. So 1-2 days a week I would get a migraine and hold my head and complain and I would get to go home. Eventually my parents took me to a neurologist who said maybe you just don't let him eat chocolate and sugar. I admitted to faking and was grounded for a long time. I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in Tridge. Now obviously I know this lady and she's fake seized a million times before. But this time it's in the lobby in front of about 30 people who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing. So she did. Edit. No, her name wasn't actually Karen. I just did that for confidentiality. My mom's an ER nurse and she said once some crazy lady came in and complained that she had the whooping cough. And whenever she coughed she followed it with a loud woo-oop. 30-year-old woman came to the ED with such excruciating belly pain. Paralyzed. "Oh god, it hurts when you press there. Must have oxycodone now." ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision and her sister only had astigmatism. They all realized she was faking it, so the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all and started to cry. She got grounded for a while. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual "I'm crippled" paraphernalia: crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic with her "I'm crippled" get up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. Sorta along the same idea. Working at a pharmacy we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever, leave it on the windowsill in my bedroom just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. No doctor but a funny story from work a couple years ago. Guy calls in sick for around 8 days. Says on the phone he is really sick. Comes back to work the next week. Tandas FCK. This dude hands a medical slip to the manager written in Spanish. On the slip there is an official seal from some random Cuban clinic. Guy walks over to me with a grin on his face saying yeah I'm probably fired. He was fired. Not a doctor but a nurse once had a patient having a seizure. The other ER nurse and I knew she was faking it. He said as much. She suddenly stopped seizing. Miraculously. Looked straight at him and yelled shut up fat boy. He and I laughed so hard. He, the other nurse, was referred to as such, fat boy, for a few months after that. At least she wasn't having a seizure. Edit. Spelling and clarification. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly coughing and gagging. Edit. Yes. Sternum rub. Got it. I saw father and his son wink when I was turning to face them again when I was done writing a note to stay home from school. That's pretty much it. Faking it is a hard call to make in general. Not a doctor but nurse. I once read a specialist consultation report and at the end of the report the actual diagnosis given was fictitious ailment. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego because the hospital is in Oswego by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like man it's weird that he's having seizures but not peeing himself. Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. I'm not a doctor but a nurse. There was a geriatric patient taking advantage of the call bell. Because she was an attention seeker, she always needed really basic things to get done for her because she thought the place was a hotel. It was a rehabilitation ward, and we should try to motivate patients to do as much for themselves as possible. She would ring the bell for reasons like please lift the blanket up for me or please pass me my phone or please feed me and claimed that her hands didn't work. I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the gist. After days of saying no and that she needs to start doing things for herself, she grew more and more frustrated. Eventually she snapped, grabbed me by my collar, shook me aggressively and yelled what don't you understand about the fact that my hands don't work? I didn't know what to tell her. I just looked at her and blinked as she slowly released her death grip off me. I guess I healed her hands. Praise the Lord. 1 upvote equals 1 prayer for an old lady's arthritis. 4th year medical student. On my ER rotation and a trauma came in from a woman that had been arrested. During the drive the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS but the patient was a great actor. Didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay, though some of the nurses said that they caught her peeking at us when we'd leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. would feel around while walking, tried to keep eyes rolled back into his head, the whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh. And of course his eyes were back to normal and focused. Guy came to ER. I was a nurse at the time. For stomachache when asking him about history he randomly mentions a fight with his girlfriend where she left in a tizzy and he fell asleep on the couch. 20 minutes later when we see the CT, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. Obligatory, not a doctor. I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the DR had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc. How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on insurance form. Doc loses his it in staff room laughing. Next week the patient loses his it in reception because his insurance has been cancelled. I'm sure there are doctors on Reddit, but they are probably hesitant to talk about their 6 lives. Young, 18-20, woman went running into small rural hospital ER pretending to have abdominal pain. Police officer had tagged her going 40+ km over the limit, which was assistant driving as per the new law in Ontario. Impound and license suspension automatic. Cop followed her into ER and apparently said he'd be waiting for her when she left. Locum staff such as myself were housed at a small band by about 15 minutes away, and the ER had pre-printed order sets to be done before we arrived. When I arrived she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents' family before I booted her. Except, BHCG came back positive, and subsequent ultrasound came back showing extremely early ectopic. Officer figures out something is up when he hears their ambulance call Carmen over radio. She was completely asymptomatic and just worked out that she dodged both charges and a life-threatening issue by accident. It was definitely a WTF moment. Edit. Well, this blew up overnight. I got a few messages. A little more info. Small rural hospitals in northern Ontario often service areas from more than an hour's drive away and still only have a catchment area of 2000 3000 people. When on call it was just that. We would do our days in the community clinic, then maybe hospital rounds, then go home and be on call. We wouldn't be at the hospital. There wasn't an on-call room where you would stay, for example. There were lots of times that you'd go a full night without being woken up, or maybe just a call from the acute care inpatient wing. Locums were short-term contracts for places that didn't have full-time medical staff for whatever reason. It's hard to attract clinicians if you don't even have broadband internet in the community. They generally pay very well. This patient comes in for back pain with weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. Patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. Patient is infuriated that they're being discharged, yelling and screaming about how they aren't better, how they are disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out 3-4 years later. I can't believe you're sending me home already. I haven't even told my family I'm here. And now you're going to send me home before they even have the chance to see me? My attending and I leave the room to arrange things with the nurses. We go back in and the patient is out of bed and standing up in the middle of the room. Miraculously the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abuse of medical services. Not a doctor, but I'm a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding. Walked into her room and found her jabbing around her V with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it anytime her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Edit. So this got a lot more attention than I ever expected. There's a lot of questions regarding birth control and questioning her parenting, so thought it best to add an edit. This patient was not by any means a benefit seeker. They were a hard-working and loving family that had full-time jobs. She had been booked in to have her tubes tied but found out a week before the procedure that she was pregnant with this baby. She just couldn't cope during the pregnancy and became very mentally unwell. She did not realize the implications or understand the face that she was causing massive harm to herself and her baby. She was referred to our perinatal mental health team and treated for psychosis. They also had a lot of input after she had her baby. She ended up having a C-section and was sterilized at the same time at her request. By all accounts she is doing very well now. Also thank you very much for the slivers. I once saw a patient who had been faking paralysis of the legs for years. Used a wheelchair, never walked, etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family friends were just going along with it, not sure if it was really conversion disorder or if the patient had some secondary gain issue. ER nurse, bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. I am a nurse but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. Faked chest pain again. Cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomach ache. I decide to go to lunch. My co-worker comes into the lunchroom. Disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he'd had fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of it in a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly he changed his tune. He admitted to faking it. Why do these people do what they do? In the story, opioids. I'm a doctor. I used to tell stories about things like this, but lately I've come to realize that many people who are faking it have a severe psychological trauma. For example, child sexual abuse, which is manifesting in physical symptoms, or some other bad cause for their factitious disorder. Even for the malingerers too. They're usually in a terrible place in life despite how much fun it is to read about their stories. We should treat both types of people with compassion and understand the circumstances that brought them to that place in life. I totally had a patient who nearly killed herself injecting her own poop into her skin though. That was pretty wild. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk, hips swaying, full stride, going places. We were all fools. I always had a hard time lying, probably due to being on the spectrum. So when I wanted to get to school as a kid, I'd always would hit myself in the stomach with my fist to not be lying about having a stomachache and wanting to go home. Looking back at it, they must have thought I was a victim of horrific bullying, but nobody ever said anything about the bruises. Looking back at it, this is horrible in so many ways. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests. Didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So I update them saying everything is fine. Tests are negative. You can go home. Patient gets up, gets dressed and walks out without a word. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. Not a doctor, but I was in the ER one night and there was a seeking drug addict who literally only acted in pain when there was staff around. You ever see those videos where the little kid is fine and then they spot a parent and then bawl, then immediately stop and be fine when the parent is out of view? Exactly like that. Sat fine. No movements or wincing or noises, then wailing when a nurse was in the same vicinity. Then back to fine when they left. One time my roommate, who is an IQ nurse, came to see one of my indoor soccer games. During the game, a player on the other team went down hurt and starting screaming in pain and swearing and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game brooding in silence before he left early. After the game, my roommate told me he was going to go over and see if there was anything he could do to help, until he saw that the guy was limping on the wrong leg. I had a patient when I worked in an ICU that was sedated and on a vent. A family member showed up out of nowhere and was staying day and night. I got pretty suspicious of them because they were clearly lying about knowing this person. Just talked to the fake family member about how it must have been sad since they just celebrated their birthday a week or so before getting ill. This person said it was a wonderful party and such. To which I replied their birthday hadn't occurred yet and wasn't for months. Turned out when security came, it was a homeless person who snuck in and found a room with a sedated patient and decided to make it a place to stay. Needless to say, security to enter the ICU was absoluted. Late to the thread, so this will probably get buried, but I'm a resident, not a psych resident. But this happened in my psychiatry rotation in medical school. When I was in medical school, there was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or veal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Not me, but know an army doctor who prescribed everyone with cold-like symptoms or sore legs to stay in bed for the whole day. Then next day half as many people with symptoms showed up. We lack proper homeless shelters here, so when it gets really cold you get a lot of homeless guys hanging out in the ER waiting room watching TV. going down to the nurse's station and getting drinks etc. If somebody tries to get them to go they say, "I think my stomach hurts. It might start to hurt really bad. I'm gonna need a bunch of tests probably. I'm not sure though. Maybe if I could sit here and drink my drink and finish my show the pain would go away." It's a stalemate. The doctors don't want to waste resources chasing down an imaginary pain, but they can't turn somebody away if they say they need emergency care, so they let them hang out and drink cocoa. Edit. Forgot the obligatory "not a doctor." I saw this story unfold one very cold night waiting in the ER waiting room for my mother-in-law who was in a car accident. The staff filled me in on what was going on with all the homeless men, and yes, my mother-in-law made a full recovery. Edit 2. On mobile and not sure what I did to make the text huge like that. I'm a surgery resident. When I was on my trauma rotation we had a patient come in after an MVC with question that maybe the patient had seized and that had caused the accident. So he's in the trauma bay and starts shaking. The trauma nurse goes, "Oh, this isn't a real seizure," and the patient stops shaking, sits up, turns to the nurse, and yells, "You don't know a ducking thing about me." Taking trauma call during surgery residency. Had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects. With enough force to cause pain he never flinched or moved his legs at all. He was diagnosed with SORA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week. No improvement. Always had one guard with him. One night they were down in the lobby watching some television but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient last seen sprinting down the road, naked butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con.